if you could recall that from the training series in last year, we have learned about the basic concept of One Health and how One Health could improve the school environment and well-being. But for this session, we will learn more on the practical tips on how to integrate One Health principles to improve school meal program and overall school well-being. And before we start the session, I would like to see how much energy you have today. Anyone can send me emoji, please. Now we have about 26 participants. I think that we can start the session a little bit early today so we can give more time to our speakers. All right, anyone can send me emoji, please. Okay. All right, may I hear anyone from Malaysia? How are you feeling today? Are you happy or you are very sleepy or you are very full? Thank you, Ka from Thailand. Thank you from the Philippines. And from Malaysia, I got your emoji already. How about the participant from Cambodia? Cambodia, how are you feeling today? Cambodia, how are you? Any participant from Cambodia? And any participant from Brunei Darussalam? Can anyone from Brunei send me emoji, please? Okay, anyone from Brunei? Okay, we got one from there. Okay. Oh, wow. Thank you so much for joining us. Now we have about 32 participants now. All right, okay. Before we start the session, I would like to request your cooperation again to have to play with me two questions. So the first question is, okay, please prepare your mobile phone to put on the screen to scan the QR code. All right, okay, scan the QR code for the first question. Did you join the training of the One Health last year? Okay, yes or no? If you join it, please click yes. If you did not join it, you can click no. We would like to know that how many have some concept about the One Health already. And if you don't have mobile phone with you, you can click in the chat box, the Mentimeter link already shown in the chat box. Okay, any more? Oh, wow, okay. So most participants already have some knowledge about One Health and 4 not yet join the training on One Health yet, right? Okay, 13 participants already joined. Okay. All right, may I wait for a while because now we have about how many participants? Okay, 37 participants log into this session. And I hope that some participants, they are in the same group, right? Okay, so scan QR code, continue scan QR code on the screen and let me know how many join One Health session. All right, so I guess that most of you already understand about what is One Health, right? Okay, so may I move to the next question? Give me one word when we mention about One Health. This is you can type 3 times, right? Or one word, one time. You can type one time. One word that come to your head when we talking about One Health. All right, you can use the mobile phone again. All right. One person from Malaysia said that connectedness. Wow. All right. One person sent a word sustainable. Anything else? Innovation, nutrition, safe food, school, human, student, well-being. Anything else? Okay, now only few already reply. Only 10 that reply to this question. So I would like more participants to engage with us by submitting the one word that when you it come to your mind. If you are not sure, you can type in the chat box. If you cannot enter to the QR code. Okay. Anyone want to say something? You can share with us. Okay, if anyone want to share with us, you can unmute yourself and give some, reflection to us. All right, now the answer is like sustainable, mostly nutrition, waste management, community, well-being, student, human, school integration, food, and also connectedness from Malaysia. Healthy, yes, that's right. Anything else? Lifelong, yes. Long life, sorry, yep. Lifestyle, yep. Right, mostly it's talking about the environment, nutrition, sustainable, integration. Right, okay. Right. Oh, I would like to wait for, there is one from the Philippines, collaboration. Thank you very much. Yeah, collaboration also appear in here. Any more participants want to share with us what come to your mind when we talking about One Health? All right, use your mobile phone to scan because I guess that some participants just log in, right? So I will give a little bit more time for this question before I can invite our speaker. Now we have about 50 participants joining us today. Thank you for your participation and your active, joining us in the activity. Ecosystem, yes, that's right. That's a good term. Integration, communicating, yeah, right, from the Philippines and from Malaysia also. All right, okay. So, holistic, yes, that's right, from Malaysia. Thank you so much. And then in the big screen, I can see that, right, more the answer is about the sustainable nutrition, health, student, long life, well-being, and collaboration. All right, okay. So thank you very much for your active participation. So, um, for the today training session, we are very pleased to have Dr. Sandra B. Tembongo, Deputy Coordinator of the Simeo TropMed Network, to be our speaker on this topic. And Dr. Sandra is a doctor of the public health. She has worked for Simeo TropMed Network as a deputy coordinator more than 25 years. And her specialization is on the public health, social and behavioral dimensions of health and One Health. And I hope that for the today's session, Dr. Sandra will give you more practical idea how to integrate One Health into the school meal improvement program and also the first school well-being. So Dr. Sandra, are you ready? May I invite you to be on the virtual stage, please? Dr. Sandra, please everyone, welcome Dr. Sandra on the virtual stage.
Thank you very much, Priya-pa, and good afternoon to everyone. Okay, so thanks for answering the second question. And I know that most of you have attended the first one. So most of the terms that you have given us are actually within the broad concept of One Health. You know, you're talking of the different elements. You're talking of the ecosystem, the human, the students, and then you're talking of the approach. No, there's the connectedness, the collaboration, the communication. These are the approach that we use because we're working. When you talk about One Health, it's actually a collaborative effort of different sectors, different groups of people. But today we're going to put it in a smaller scale, which is really looking at the school and how One Health can actually be integrated in our school meal program. No? So, but I'd like to congratulate everyone for sharing your one word, the word that comes right to your mind when we mention the term One Health. These are all correct. And as we go through the presentation, you would see where that particular word that you gave would actually fit in. So thank you very much. Okay, so for today, I'd like to really look at, because you already had the basic concepts last time, how do you operationalize and how do you put One Health in your program of school meal improvement, no? If I remember, I was also looking at the different proposals, and somehow there's a little bit difficulty of integrating and really being specific on how the One Health concept can actually be placed into your program. Hopefully, this presentation today and our discussion will somehow support or clarify these things to you and allow you to be more specific and to really see what are some of the practical things that you can do so that you can really mainstream the One Health concept in your school meal improvement program. My title is the school lunch program because I really wanted to have it broad, no? Whatever. It may not be a meal, it may not be a lunch, but the school health program as well. Okay, next slide, please. Okay. Now, what are the objectives for this session? No? There are two main objectives. One is to enhance the knowledge of the school teams on the relevance of One Health in the school lunch program or the school meal improvement program that all of you are going to implement for the SEPs. No? And also the second objective is to provide examples and give you some tips on how to operationalize very practical activities that we can actually mainstream One Health related concepts in the implementation of your school meal improvement program. It's not a very difficult concept. One Health is not really difficult. I'd like to make it very practical in your level because we're focusing more on the school meal improvement program. Okay. Okay, let me just repeat what is the definition of One Health. One Health is actually an approach, no? It's an approach and a concept. It started with a concept in 2004, but then as the evolution of the concept now realizes it's really both a concept and an approach. That what is important, it underscores the interconnectedness and interdependence between humans and animals and the shared environment of these two dimensions of humans and animals. So we all share one environment with both the animals, people and animals share one environment. So there is that interconnectedness. Whatever the behavior, the condition of one can actually affect the other because of that interface of animal health, human health, and environmental conditions. No? It's very much influenced by the behavior and the condition of all of these three elements, which we will see later on. And the goal of One Health is really to prevent health threats, meaning to prevent transmission of diseases, to prevent the spread of diseases. And if we go down to the level of the school, is to prevent health threats at the school, at the different constituents or the different stakeholders in the school, at the school, the students, the teachers, the officials, and the other employees in the school. So because there is always a health threat when human animal meet and interface in the shared environment. And the shared environment here, as we will see later, is actually the school. Now, the health threats can include the zoonotic diseases. I think in the last session in One Health, zoonotic diseases was defined as diseases that can be transferred from animals to human. So it actually, and the COVID-19 was actually a very good example of that. It's considered as a zoonotic disease. It also prevents health threats at the antimicrobial resistance level. So humans being resistant to antibiotics, also the resistance, the growing resistance of animals to antibiotics is also affecting us because animals are our food sources. And definitely food safety and security. There's a lot, and for this session, because we're talking of school meal, we're more focused on the food safety in terms of the concepts of One Health. We also talk about, for One Health, the goal is also to prevent health threats, especially the vector-borne diseases, environmental communication. When we talk of environment, we talk about air, water, soil, everything around us, and even the chronic diseases and mental health issues. It has already expanded. The concept of One Health has expanded that it has now include, and they were able to see that mental health is really a relevant issue in One Health. So you see, it becomes broad and it can actually be very much relevant to your school meal improvement program. Next slide. So let's look at the goal, no? The goal of One Health and the goal of the school lunch or the school meal improvement program. The goal of One Health is to prevent health threats. Okay, and the health threats, when we're talking in the school, it's actually the health threats, especially of the students. The goal of your school meal improvement program or the school lunch program is really the promotion of well-being of students. You cannot have you cannot have this well-being state of students if they have health threats. So the goal of One Health and the goal of school lunch are actually very complementary with each other. It's very close, and they only have one goal, which is the improvement of the health and well-being of the students, especially our young students. So there's no, I think there's no contradiction as far as the goal of One Health and the goal of the school meal improvement program. Excellent. Now, let's look at One Health. In One Health, there are three major dimensions, right? And you talk about it. You talk about people, you talk about animals, and you say environment. So you were able to identify in the Mentimeter earlier, in the second question, the three broad elements, the three major elements of One Health. The people, the animals, and the environment. Now let's look at your school meal improvement program. Who are the actors here? What are the major dimensions? You have people as well, right? You have the students who are actually the recipient of the school meal improvement program. You have the teachers who are actually involved, and you have the food handlers. These are very important characters in the school meal improvement program. So again, there's that alignment. You have humans in One Health. You also have people in the school meal program. You have animals in the One Health concept. in in the school meal program, when we talk about food, animals are our food sources. When we talk about animals, the animal kingdom, it's not just the big animals, the cows, the goat. It includes the fish, the birds, the small ones, and it even includes insects. That's part of the animal kingdom. But for today's session, I'm going to focus, because we're focusing on the safety of food here, the school meal lunch, is we're going to look at the pests. Animals and human usually have a very positive relationship, but at the same time, they also have some negative relationship if the conditions are not healthy. See, if the conditions are not healthy, if animals are sick, humans are sick, environment is not healthy, then the relationship, the interconnectedness becomes negative, and some of the animals becomes pests. Okay? So when we talk about environment in One Health, what is environment in the school lunch? The environment in the school lunch program, you have two types. I would classify it as two. One is the school canteen, where you do the cooking and the eating spaces, the preparation of the meals. And the other is the overall school environment that actually also influence the health of the environment inside, even in the canteen or in the eating and cooking areas. So the dimensions of One Health, the three major dimensions of One Health, is present in our school lunch, right? In our school meal improvement program. So when we talk about integration of One Health concept, this is where we can actually integrate the concepts. And the next slides, will actually give you some tips on how to integrate in these different dimensions. Okay, people. As we said earlier in the last slide, the more important people when you talk about school meal program is actually the students, the food handlers, the teachers. The food handlers, they're very important as far as the school meal program is concerned, because the condition, the behavior, the personal hygiene of food handlers will definitely affect whether or not the objective of your school meal program is going to be attained. If your food handlers are sick and can be the cause of the transmission of disease, you're actually also causing the health problems for the students. So personal hygiene is vital when working with food. And there are certain standards of personal hygiene when working with food. It refers to the hair, body, hands of the food handlers. The behavior of the food handlers, the condition of the food handlers, and the habits of the food handlers definitely affects the condition that would definitely will affect the students and the environment, and we will see that later. As far as the food handlers, there are certain standards of personal hygiene when working with food. No? Food handlers are expected to wash their hands regularly and thoroughly in the process of the preparation of the food, in the process of serving. The food handler should always wash their hands frequently as they can, and thoroughly, hopefully with soap and water. The hair, if you look at the pictures, the hair of the food handlers are tied up in a bun and is covered with a hairnet. Can you see the hairnet? The hairnet is there, It's not very clear because it's black, but you can see that they are using hairnet. They're even using a mask, because this was, I think, this picture was taken after the COVID pandemic. They're supposed to have short fingernails because, as we know, under the fingernails, the dirt or whatever can actually be present, which can contaminate the food while it is being cooked or while it is being served. clean clothes and protective clothing should be used. Again, if you notice, the two food handlers that we have in the picture are both wearing clean apron. Okay, so that is also a protective, because the clothes that they are wearing, maybe they use it from their houses to the school, and it was exposed to some dust, to some germs while they travel. So they need to have another protective clothing that would somehow protect the children and the food from the contamination. No coughing, sneezing over food and the preparation during the preparation and in the serving areas. And that's why I think the use of the mask is a very good response to that particular standard. And there should be no smoking, eating, or drinking when handling food. When the food handlers are sick, they are not supposed to be cooking or doing or reporting to work. We have a lot, I think, in your meal program, in your meal improvement program, you have several volunteers, the mothers, which can actually rotate when one is sick. No? And if they have open wounds, this wound should be covered with a transparent plaster. One of the things that I suggest for you to include in your action plan, in your activities, is a simple training for food handlers, so that they are reminded of the standards of personal hygiene. I think you can talk to your health people at the level where you have your schools, at the health center, and they can give maybe a 1 day or a half-day training to your food handlers. The health people at the health centers, it can be very accommodating in providing training for your food handlers, because this is a must, that they should be reminded. If you notice in the picture, they're also using transparent globes because they are handling, they're actually touching the cups of the students. So all of this is standards of personal hygiene, is to ensure that the food handler will not be a cause of infection, no? Because if the food handler is sick or the food handler is not careful with his or her personal hygiene, he might be able to transmit some infectious diseases to the students. He might be able to contaminate the area, the environment where she's working, and the students might also be infected with the contamination. Okay, so that's the food handlers. The students, this is the other group of humans that are actually important or are involved in your meal program. No? And in the meal program, you actually have, I would look at it and you would say, I think you have three major objectives there. One is really to improve the nutritional status through the provision of access to healthy meals that is actually being prepared as part of your meal improvement. And this meal should be an opportunity, a learning opportunity for the students, for them to be able to develop healthy behavior and healthy eating habits. No? It's not just the healthy eating habits, but the behaviors related, which one of the behaviors we will discuss later in one of the slides. So that's the other objective. That should be clear in your mind, no? That it is not just to give the meals, but rather these are learning opportunities for the students to be able to form or develop healthy behaviors and healthy eating habits. What you serve would actually define for them what is a healthy diet, and maybe they can bring that knowledge home and be able to enjoy these healthy diets, and so that they develop that kind of healthy eating habits. At the same time, I think because of the inclusion and the integration of the SEPS concept, the sustainability concept, you're also able to this meal improvement program is also an opportunity, a learning opportunity for the development of sustainable philosophy among our students. We always have that philosophy that they should be taught early in life, sustainable development philosophy, healthy habits and healthy behavior, which they can bring into adulthood, which they can bring home to their homes, to the families, and later to the community. So for me, the meal objective, the school meal program, is not just providing access to healthy meals, but would also be learning opportunities for the formation of healthy behavior, healthy eating habits, and the development of sustainable philosophy. Okay. Now the students. Students, as we said, is one of the important, and there are situations in the process of uh, the daily meal. I hope that the teachers who are involved, looking after the students, would also be conscious of the health situation of their students, no? Because there are situations where students should not be reporting to school, especially if students have fever, which is 38 degrees or higher, when they have contagious illnesses like flu, strep throat, chickenpox, or the COVID-19, when there's severe cold or flu symptoms, or they've been vomiting or having diarrhea within the past 24 hours. Because once the students report to school to join the school meal, there might be only transmitting and spreading the disease to other children. Again, you would see that the behavior of one of the one of the components, which is the students, can be negative because of the behavior. So I hope that the teachers, um, of course, the parents, the decision should start at home, but sometimes maybe not because of for some other reasons, the parents miss these conditions, and it's up to the teachers to make sure that these are not present in the students who are participating in the daily meal program. Okay. Okay. Now, hand washing. As I said, that the students, the food handlers should have the personal hygiene. One of the easiest and most effective defenses against communicable disease, against the transmission, the spread of communicable disease, or even getting infected, is actually hand washing. There's a lot of before COVID-19. One of the positive results of COVID-19 was that a lot of people started washing their hands, regularly. Whereas I think before COVID, there I'm sure there are a lot of people who do not really practice hand washing regularly. But the COVID experience, and because when COVID started, there was no drugs, there was no, we don't even have the mask at that time. Maybe Thailand started early with the mask because of the pollution. But the health group started talking about hand washing, hand washing, hand washing. That was the only defense that we have, plus the mask and the distancing against COVID, because there was no, it was even late when we were able to really say it's COVID-19 before we were able to come up with a diagnostic tool and to come up with drugs. So hand washing was our best defense against COVID-19 at that time. So this concept of hand washing, when to wash hand washing, should be very clear to the students and to the food handlers as well. The simple act of cleaning hands can actually save lives and reduce illness by helping prevent the spread of infectious diseases. Now, actually, hand washing has been proven to reduce deaths from respiratory diseases by 21% and from diarrheal diseases by 30%. Just for the simple hand washing, washing hands properly and regularly, we are able to reduce deaths from respiratory diseases and diarrheal diseases, 21% and 30%. So you can see the effectiveness of hand washing. Because people frequently touch our face, no? Especially students. They frequently touch the face, the food, the different surfaces, the doorknobs, and these are where somehow the pathogens are. The contaminated surface, the doors, the knobs. These are contaminated with some of the pathogens, some of the germs, and we should be able to teach our children, our students, to do hand washing. My suggestion is, can we come up with posters about hand washing in the school to remind the students that they need to hand wash after using the bathroom, after playing outside, before eating, after touching animals or the cages, or after playing with animals, after blowing your nose. Now, if this can be placed in in areas where it can be seen and read by the students. Okay. Now, when we talk about hand washing, it's just wetting our hands with water. No? Okay, we say, soap and water, but there's also which part of the hands. We're talking of all the different parts of the hands for proper hand washing. If you remember, for the food handlers, I said frequently, regularly, and properly and thoroughly. No, it is only when you're able to wash these different parts of the hands can you say that you were able to properly wash your hands. So I hope again this poster can actually be shared with the students, with the food handlers, so that they will be reminded on how to wash their hands properly. Because sometimes the students are in a hurry, they just wet and run after uh, after wetting and maybe touching the soap. Okay. So I hope that these 7 steps to hand washing will be made clear to the students and to the food handlers. Okay. Now, so the people, which is the food handlers and the students, these are the most important as far as people and humans are concerned. Let's go to animals. As I mentioned earlier, the animals and humans always have actually a very positive relationship. Animals can serve as food sources. They also serve as a companion. They serve as pets. They are sources of income. But somehow the condition of the animals can actually, and the behavior of the animals can also result in relation to human to negative relationship. And that is what is the condition of the pests. No? We have, I, I only pick 3 common pests that I think is common in Southeast Asia and in our homes. I'm sure you have seen these 3 pests that I will be talking about. These pests, they are called pests because they can contaminate food with bacteria and other pathogens, leading to foodborne illnesses and other health hazards. They don't only contaminate the food, they also contaminate the surfaces in the food preparation areas. They contaminate the equipment, the kitchen utensils, other things that we use for preparing food, which can lead to the contamination of the food itself, which the students will be able to partake. So the most common pets that I have identified, the first one is the house flies. You're very familiar with house flies. I think everyone has a house flies. And this is very common in the school, right? Somehow. House flies can actually pose a very serious health risk when they come in contact with your food because they carry, they actually carry, even on the wings, their feet, their skin, they actually carry pathogens which can, like bacteria, viruses, eggs of parasites and fungi, which can actually cause disease. A 2018 study were able to identify that over 130 pathogens are found in houseflies. And that these flies can actually spread about to 65 dangerous illnesses to humans, including cholera, dysentery, typhoid fever. So all of this. So somehow we're not very conscious of this, right? We just shoot the flies and we think it's okay. Now, why is house flies dirty? You know, the behavior of flying from their nesting places where they actually are, and then they rest on surfaces, and then they rest on the food, even for a short period of time, can already contaminate the food. Flies are drawn to food odors, and the food odors are actually the ones that are very smelly, the ones that are not fresh. They're drawn to garbage. This is where you will see most flies. Garbage and decaying matters. That's why they carry with them a lot of pathogens. And when the flies get food, usually their behavior is they regurgitate first. And when they regurgitate their saliva, they're actually already introducing some pathogens that are in their crops. So, the crop is where they store their food. It's called the crop. So it's really one of the serious health risks, which to a certain extent we're not very conscious of. We just shoot the fly and continue with whatever we're doing. But the fly pose a very serious health risk when they come in contact with our food and with all the different surfaces in the preparation and cooking areas of your meal. Okay. Now, what are some of the tips for keeping flies off your food? How many do you know the lemongrass? Lemongrass is very popular in Thailand, no? It's mostly always present in all the food of Thailand. It's actually a bug repelling plant. So put a bug repelling plant in the kitchen, in the area where you're preparing food, and also in the eating area, no? So one of the things that you have to do is to reduce the breeding environment. And the breeding environment are the dirty areas, your garbage, where the decaying. I was thinking of compost because I know some of the schools would put up a compost, but I think you should be able to cover your compost so that the flies, because that's decaying, rotting food, vegetable peels and everything, fruit peels, and that can attract flies. So the suggestion is to cover your compost. If there's a lot of flies in the dining area, you use fans if it's available, so that it will fly out. Be sure to cover food. Should be able to eliminate trash regularly. Keep your trash bins clean and covered always. If you don't have the bug repelling plants, you can also set sticky traps. But the suggestion is always use the natural repellents first rather than the insecticides or the pesticides. try to use the natural repellents first. Okay. So there's several things that you can do within the cooking area, within the eating area when you now serve your meals, so that you can keep off the flies from the food. The second most common pest in our kitchen is the cockroach. The cockroach, no? Everybody has seen a cockroach. When you see a cockroach, it actually indicates unsanitary condition. That cockroach thrives best in warm, humid, excess moisture, poor sanitation, a lot of food debris. You usually the under the sink where you have all of this moisture, you have under the oven or the cooking area where you have grease or food debris that is under. These are warm areas, humid, and that's become the nesting or the breeding place of cockroach. They're attracted to that, and so they multiply in that particular area. And they would always have the presence of food debris is actually a come on for them because there's always food. The presence of the moisture is also come on because there's presence of water. Okay. These cockroaches, they carry proteins in their feces, saliva, and body parts that can actually trigger allergic reactions and asthma, especially in children. And because of the behaviors, they actually thrive in dirty areas. They can carry again bacteria and other pathogens that can cause actually illnesses and diseases. Okay. The next one, so this is how you can prevent cockroaches from entering your kitchen. Eliminate the source of food of cockroach, which are actually the grease, the food debris under, these are all their food. You have to clean kitchen cabinets regularly. Don't leave unwashed utensils overnight because cockroaches are nocturnal insects. Cockroaches, if you notice, when you put off the light, that's when the cockroaches gets out, and you put it on, they right away come and try to get out. Yeah. So don't leave unwashed utensils overnight because that would be where the cockroach will go because there's again food debris there, some grease, which is food for them. Declutter your kitchen. The simpler, the clearer the kitchen is better. Again, if you can use natural cockroach repellent and seal the entry points. The cockroach can actually enter the cracks, your doors, underneath the door. If there's a little opening, they can actually go there. Fix water seepage under the sink, or there's a leaking pipe. You should be able to fix that because the humidity and the water that is there is actually attracting also cockroaches. Okay. So these are some of the ways on how you can prevent cockroaches. I know that your kitchen are clean, but I think if we are able to understand the behavior of cockroaches, the behavior of flies, we are more aware and become more proactive in preventing them from contaminating our area, the food preparation area, and the food itself from these pests. The last one, I don't want to look at my picture. The last one is the rats. We have common rats. We always have rats. And it's one of the most dangerous pests you can find in a food handling environment because they actually carry a lot of foodborne pathogens through their saliva, urine, and droppings. They have a lot of droppings, and they're capable of spreading over 100 dangerous pathogens. They also carry parasites like fleas and ticks, which can again affect our children, not only in the food, but also our children because of the dangerous pathogens and the parasites and the ticks. So it's not just only affecting food safety, but also directly affecting the health of the students and everybody in the school. What is a conducive environment for rats? This again includes warm environment with plentiful stock of food and water. So your food should be closed. The food that you have in even the raw food, the grains and everything, it should be in tightly. Remember, they can actually destroy plastics, no? The plastic containers can actually be destroyed by the rats. So be sure that when you stock your food, it is not in plastic containers. It's poor sanitation, there's a lot of food debris, and the presence of wide variety of location for nesting and reproduction. Where do the rats nest? Usually they nest in a pile of newspaper, carton boxes, when there are cracks in the ceiling, because it's warm, it's dark. Again, rats are nocturnal, and these are very conducive environment for rats. So take a look at remove all, we say declutter, no? Remove all those unused newspapers, empty boxes, empty cartons, and be sure that it is clear. The environment, the kitchen, the eating areas, and even the entire school should be clean and should be clear so that we'll not be able to provide a nesting area for the rats. What are some of the tips to prevent and get rid of rodents or the rats? No, make sure rubbish bins are always covered properly. Again, the rubbish bins. This is where they get their food, and it's because it's unsanitary, so they like unsanitary. You always empty your bins before night falls because at night that's where again they go out of their nesting areas and go walk. They actually roam around our kitchen, our counters, our tables. Even if our kitchen utensils are not covered, they can touch it. They can contaminate it. Seal potential entry points, the cracks in the windows or in the doors. The rats do not have, I think, a bone in the neck, no? So they can squeeze in even in very small cracks in the wall. One of the suggestions is also to trim bushes and trees bushes and trees beside your canteen, because they can climb the tree and they can use it to reach your canteen or your areas for cooking. So as much as possible, you have to be able to trim these bushes and trees to prevent the rats from climbing the tree and crossing to the kitchen. As we said, store food in the right way. The plastics, they can be destroyed, and repair the leakages, because these warm, humid, and moist areas are very good for rats nesting. Okay, these are just some of the conditions and some of the tips on how to prevent and get rid of rodents. Now, when you talk about pest control, that would, at the end of the day, if you really have this pest and it's difficult to control, it's advisable to get a professional who would know how to do the pest control. There's a lot of pest control, but our suggestion is to focus first on pest prevention, because this is more eco-friendly, this is more environmentally sensitive. We're talking of sufficiency economy. All of this concept, if we start with pest prevention first are better, no? Because, and the pest prevention here is removing conditions that attract these pests, such as sources of food for them, sources of water for them, and sources of shelter for them, which are their nesting areas. Use only pesticides as needed when it's already difficult to contain. So because focusing, I said, on pest prevention will provide a more effective and environmentally sensitive approach. So now you see that actually only about 1% of insects are pests. Insects are also very useful, like bees are, they're very useful to the ecology, to the environment. But 1% only of insects are considered as pests, and only a small percentage of animals, the big ones of animals, are considered also as pests. And you can see that the condition, the condition of the environment, the condition of these pests, actually affects human health. Can actually affect human health. Also, the behavior of these pests. They're nocturnal. They thrive in dirty conditions, and because of that, they are able to bring a lot and to transmit a lot of pathogens to humans and to also the spaces where we live, which would allow us to be infected with some of the infectious diseases. So again, you can see there the interconnectedness. As I said earlier, we're focusing on the negative relationship, but you can see the interconnectedness between the environment, the people, and the animals, which are now, we're focusing on the pests as far as animals are concerned. So this is a joke. This is a very effective spray that they're not just able to rid their homes of backyard pests, even their pesky neighbors. But that's a joke. Don't do that. Okay. Environment, which is the last component. We already talked about people, we talk about the pests, and now let's look at the environment. When we talk about environment, as I mentioned earlier, in our school meal improvement program, you have focus on the inside environment, which is the cooking area, the eating area, the whole space, and then you have the external environment, which is the overall school environment. The condition of the sanitary condition, the state of cleanliness of all of these different environment would definitely affect this relationship between the pests and humans, in our meal program. Because the dirtier the environment, the more pests we will have, and the more pests we will have, the more possibility, the more danger of these pests infecting all the different areas in our food preparation, food eating area that would affect the students directly and indirectly. Okay, so that's the environment when we talk about our meal program. The kitchen, which is the internal environment. Safe food, of course, depends on a clear kitchen. When we talk about control of bacteria and viruses in the prep area, we can actually sanitize the kitchen. The tops, kitchen tops, we'll talk about it later. And one of the cheapest sanitizer that you can use is you can have the chlorine bleach solution. 1 tablespoon of bleach, ordinary bleach, to 1 gallon of water. And you can use that to sanitize the tables, the cooking area, the chairs, the floors. Okay. Here are some of the rules, kitchen rules. Clean all the surfaces before and after use, before cooking, before eating. Sanitize the cutting boards. Don't only wash the utensils. You have to also sanitize the cutting boards, especially when there's contamination. Clean and sanitize the zinc. You clean the appliances regularly. If possible, you have to use hot, soapy water. Now, one of the dirtiest thing in the kitchen is the sponge that we use to wash our plates and kitchen utensils. How often do you change or replace your sponges? It should be replaced frequently. Don't buy the expensive one, buy the cheap one, but you have to replace it frequently, no? Not only the sponges and the dishcloth. If you look at all of these dishcloths around, so dirty already. I can see some of the dishcloths that are dirty. Sanitize high-touch areas. What are the high-touch areas? These are the areas like doorknobs, tables, chairs, where a lot of people are touching it, no? And so sanitize it to reduce the number. So you have sanitized kitchen tools after use as well. Okay. Now, when we talk about the kitchen kitchen hygiene, we're talking of two processes: the cleaning and sanitizing. Cleaning means removing the food bits, scraping it, and washing it. No, that's cleaning. But sanitizing is reducing the number of pathogens. So we sanitize because even when it's washed, we are not sure that the number of pathogens, we know there's still pathogens, but if we sanitize, we are sure that we can reduce the number of pathogens. So you have the five-step process. You first scrape, remove food bits, and then you wash, then you rinse the surface, and then you sanitize the surface and allow the surface to air dry. What are these areas or surfaces? These are the countertops, the tables, the floors, the sink, the drains that are actually used and can actually serve as nesting, no? Nesting for the cockroaches, for the rats, and the ones that are always, more often than not, contaminated by all of these pests in the kitchen. So these are some. So you do cleaning, you do sanitizing, and for sanitation you can use the chlorine solution. Okay. Okay. So we've talked about the environment, the people, the pests. But there's another thing that will allow you to meet the objectives of your improved meal program. When we talk about hand washing, we said the food handlers, the teachers, the students should always wash their hands frequently and thoroughly. But if there's no water, no hand washing facilities, we will have a problem. So if you can also, maybe not as good as this one, but maybe make sure that they have access to hand washing facilities. They have access to potable drinking water, because even if you are you are actually serving them meals so that they can improve their nutritional status. But if your water is not potable and their source of water is not potable, you will not meet your objective, because they might have also some diarrhea issues. And of course, the sanitation, they should always have the sanitation so that they can properly defecate or do their sanitary behavior. So these are some of the facilities that would allow, that can help and will not serve as barriers to meeting your school meal improvement program. Okay? So hopefully, since you are talking to if I remember when I read your proposals, you're talking also of a partnership with different groups, And if you have a problem on these areas, these facilities, maybe these are some of the areas where you can request support from the different groups and organizations that you want to partner with. Okay. So, okay, thank you. Now let me let me just summarize. So it is not difficult to really see the relationship and the relevance of the One Health concept in your school meal improvement program. Hopefully, with this very informal discussion, and we'll have a discussion next after this, we can provide you with some pointers. We were able to provide you some pointers on really how to make sure that some of the One Health concepts are in place so that your objective of improving well-being, improving nutritional status, the formation of healthy behaviors, the formation of healthy eating habits will actually be met. So thank you very much for listening.
Thank you very much, Dr. Sandra, for the wonderful presentation. May I request our participant to give her a virtual round of applause. So thank you so much. So you can send emoji to Dr. Sandra. I think it is very, very clear right now about how we could integrate One Health to improve the overall school well-being and also the school meal program. And some issues that Dr. Sandra already explained to us is some activity that we already apply to your school already, right? But this type of thing that make you to have like a big picture, how you can integrate the different type of things into the three main dimension, which is like animal, environment, and human. So thank you so much, Dr. Sandra. All right. So let me check if there are the questions from our participants. I would like to challenge our participants to ask the question directly with Dr. Sandra first. Please unmute yourself if you have anything that you want to clarify with her. And also for some participants, you can drop the question in the chat box. All right. So I guess that I got some questions here from Cambodia. And may I know if any participant would like to ask the question to Dr. Sandra? You can double check with her if your actual activities that you are doing at the school is now okay or not, All right. And the Philippines, I see Miss Baptist Elementary School. Baptist Elementary School, yeah.
Piapa, I saw something, no?
Yeah.
I can reply to that.
Yes, sure. Dr. Sandra.
Concept that if the school is the only one that is clean, it's not enough. That's true. But once you start cleaning the school environment, you might be able together, because your meal program, your school meal program, you're actually involving communities, right? Yeah, you're supposed to be involving communities, your mothers as volunteers in your meal program. You can actually ask them to start also cleaning their areas. So it becomes a community activity. But the school actually starts. The school serves as a role model. And that can actually influence the bigger community. And your students are actually can also serve as your change agents. They can bring these concepts back to their families, back to their homes, if they understand the relevance of all of these projects. And also during your training of food handlers, you can actually discuss about environmental sanitation there. So it's actually really getting big, spreading outside of the school because you're supposed to be working with your community, with your mothers, with the different partners. So you can spread that out. I just focus on the school because we're focusing on the school meal, but it's not. I agree with you. If the school is the only one that is clean, it can still be contaminated by the pests outside. You know. But
That's
if it becomes a community, even in your district, around the area, you can start.
That's right, Dr. Sandra. Thank you. And there is another question from Cambodia. May I know any experience from other countries that the contribution or responsibility of the local authorities to promote One Health in school and community?
Yeah.
You can give experience of the Philippines or other country that you have experience in training.
Actually, because the COHUN, if I can actually also come up with answer this one, no? The COHUN, part of the different countries. You have TOHUN. I know TOHUN is working with not only with the universities, they're also working with communities. And that community, they also come up with some One Health concepts and One Health project there. The, the, the project, the LAWA project that was shared last time was actually also involving some communities, and involving the local government. So as long as the local government, and this is where I think you're networking in the school, because part of I remember because I was more on the Philippine group, no? When I look at all the what do you call that? All the proposals submitted for the Philippines. There's always working with local government. So if you are able to really influence the local government, that would be very good. And you can start with your the health people there, because they're into health, so it's very easy to work with them. And the health are the ones, actually, we are now the only ones, I think, that is working in the education as far as One Health. SEPS, StropMed, and then SIMEO. SIMEO now started. We're the only ones who started the education component. But long before, the ministries of health and the ministries of local government are already talking about One Health.
Thank you for that. And there is another question from the Malaysia. Our school using rainwater harvesting system to reduce water consumption from pipe water supply. What is the hazards and correct use of pipe water and rainwater? I noticed that some students drink pipe water directly. Is it safe?
Okay. The safety depends on the collection. The manner of collecting rainwater. If it is closed, if you are using the correct pipes or bamboo pipes and directly to jars, big jars, and covered, it might be safe. But it really depends on the manner of collection and storage. Okay? Because in the process of collection, there will be contamination. In the process of storage, if it's not properly covered and stored, it will also be contaminated. So for you to be sure, have your water tested. It's not very expensive. Again, you have to go to your health people because they would be very willing to do the water analysis. Actually, rainwater is used in other countries, but as long as the manner of collection and storage are correct, that will not allow or somehow reduce to the minimum the contamination.
Right, thank you so much. And there is a comment from the Philippines, from Dulong Bayan School, saying that she suggests clean up drive should involve parents and stakeholders.
Yes, that's good. Yeah, that can be part of your extracurricular activities, you know. Yeah. Because you have to connect the environmental condition with the meal. We are feeding the students, but if the environment is unsanitary and then cause illness, cause diseases, we will not meet the objective of nutrition, you know, improving nutrition, even if we feed the students because of the health problems. So it should really be that's why we're saying, remember some of you said collaboration, communication. It's really collaborating with different sectors, communicating correctly with different sectors, with different groups, all the groups in the community, you know, government, the civic societies, or the small groups, the barangays, or whatever, barangay is in the Philippines, the villages. So if there's this kind of collaboration, you can you start small. Don't think of big projects right away. I think you have to start small and show them that it can be done.
Right. Okay. So, may I ask if any participant would like to ask the question directly to Dr. Sandra? You can raise up your hand or you can unmute yourself. Oh, wow. This is another comment from the Philippines, from Miss Foreign, from the Baptist Elementary School. Being a role model in the community is a huge community, but through One Health concept, we can spread the idea activity with the pupils and parents. That's a
Yes,
good message. Yeah, that's right.
yeah. That
Okay.
the school is doing the meal, the preparation, the meal improvement program, but it should need help from the community. So, in fact, in your one of the conditions is to use local products. If the local products are clean, you know, the environment. If the environment is clean, the local products can be clean, will be clean.
Okay, thank you very much, Dr. Sandra, and thank you so much for the our active participation of participants. And we are sorry that we're running out of the time. So may I go to the next session? I think that we are now go to the photo session. May I request everyone to open the camera? All right. Okay, we will have the group photo again. This is the most exciting session for our participants. Okay. All right. Okay. So everyone, okay, I will take the photo for two shots. The first shot is a proper one. All right. So may I request everybody to open the camera, please? Okay. Now I can see everybody now very active. Thank you for your active participation in the session. All right, okay. The first shot. 1, 2, 3. Okay, just wait for our technical team to capture all of you. We have now today about nearly 60 participants. Right, for the second shot. Freestyle. I don't know what to do. One Health. Oh yeah, One Health have to do like this, right? One Health. One Health. Yeah, this is the symbol of the One Health. All right, everybody, One Health, please. Just, yeah. All right, okay. 1, 2, 3. The second shot, please. 1, 2, 3. Okay. Thank you very much for your active participation. And for the next part is about evaluation. So, please do not forget to submit your evaluation because in the previous session, there were about 80 participants join us, but only 50 participants fill up the form. So, where are another 30 participants? So, please don't miss this part because it's about the certificate of participation. Our team also dropped the short link in the chat box, and please scan this one. All right. Okay. So may I introduce for the session tomorrow? น้องเอ๋ยคะ All right, Dr. Sandra, for tomorrow's session, we will have about food safety and food waste management. This topic really requested by our participants. Right. So for tomorrow's session will be Dr. Jesus C. Fernandez, the former Deputy Director of the Simeo Rec Fund or Simeo Regional Center for Food and Nutrition. I think you met him before in the previous training session. Right, and also he also was the evaluation committee member as well. So I would like to invite everybody again to join the tomorrow session at the same time, 3 p.m. Bangkok, Indonesia, and also Cambodian time, or 4 p.m. for the Philippines, Malaysia, and Brunei Darussalam. All right, okay. I think that today we learned a lot from Dr. Sandra. Please give a big round of applause to her, please. Thank you so much, Dr. Sandra. We really appreciate your knowledge and your guidance to our participants how to apply the One Health into the school meal improvement program. Dr. Sandra, thank you very much. All right, okay. Everyone, thank you so much. And I hope to see you again tomorrow. Dr. Sandra, thank you very much. Thank you.
Thank you also.